We still have a few people coming in. Come on, we got seats, although they're quickly disappearing. All right, so we want to welcome you here to Holly Hill Health Foods. You're going to see some of the things I used to do over at Abington Hospital. I ran the stress management center there. I was the director. I did it for about 3 years. And I learned a lot about, I thought I knew something about stress when I started doing it. And then I actually saw what daily, dated, what you go through on a stressful day. And you hear a lot of really difficult stories. And then you also hear people just, I got this job and I get upset, I come home, I have problems, and what do you do about that? So we're going to be talking about good stress, bad stress, and how to manage stress. And at the end, again, you can question me all you want, and I'll try to answer the questions as much as possible. And I think we got everybody in here now, so we're going to start to go. All right, so what is stress? When I was, maybe back in '99, when I was starting to put stress ideas together, I actually had a hard time kind of defining it. So this is not my definition, but it's a state, a physical state, mental, emotional, could be strain, tension, could be a safety thing. You go to cross the street, right? You step off the curb, your heart rate should increase, your blood pressure should increase a little, and you suddenly become much more aware, right? If you didn't, you could get run over possibly, right? You've got to be aware of what's going on. And people who get hit by cars usually aren't aware. And I've seen it happen. Now, unfortunately, I was a witness. And this is a person who's just crossing the street, just like it's not a 6-lane dangerous street in the Market Street in Philadelphia. And you get hit because you're not paying attention. So you should be paying attention, but when you get to the curb on the other side, you should be able to relax again and go back to where you were. So stress has an important part to play. So we all heard the term, he's obviously under a lot of stress. She's stressed out. You hear this stuff all the time. What does it mean? It's a huge meaning. You could include a lot of people in that. I'm stressed out because I'm here doing the talk, I guess, right? So the terms are a little all over the place. But the truth is, there are certain things about stress that are recordable, or you can write them down. When you see my stress or somebody's stress, we get a volunteer, you'll see that I can change their stress levels just by making them do something. Somebody will have sky-high stress even when they're just sitting there relaxing. Other people will have low stress levels. So it's quite variable, and you'll see why that is. Tension, worry, anxiety, nervousness, trouble, difficulties, distress, trauma, pain. Pain causes stress. So it's not a big leap from stress to anxiety. So if you're under stress all the time, there's a possibility you could end up with some pretty serious anxiety, or at least some anxiety. And anxiety just is kind of fuel on the fire. So if you got a backache when you were stressed out, you're going to have a worse backache when you have anxiety, possibly, or whatever condition's bothering you. So it's important to manage stress, and we'll get to that, but I want to go through a few more terms. Anxiety is a little deeper than stress. We can look at it that way. We could say you're worried a lot, nervousness, uneasiness. It's a little more than just normal stress. When you see those things, though, a warning bell should go off. Maybe I need to try to do something. You may need to go to a doctor. You may need to get in some kind of stress management program. where you can handle anxiety and stress. We do that here. This term, he felt a surge of anxiety, surge of anxiety. You will hear that a lot from people. All of a sudden, I got very anxious. Why? I had a client who was perfectly fine, but couldn't cross a bridge in their car. I don't think they could walk across a bridge either. So that's anxiety. So what does that bridge mean to that person? Well, I can't get into all that, but something made that happen that's part of the anxiety. It's not the bridge's fault. Okay? So, concern, worry, apprehension, uneasiness, it's just not a pleasant thing to have anxiety. And unfortunately, anxiety, stress maybe comes and goes. Hopefully it does, and that's the way it's supposed to work. Anxiety can run under, it's like your computer has something working in the background, it slows things down. Anxiety is doing that to you. And you'll see how anxiety creates a lot of physical damage that you tend to regret when you ignore it. And I've got a great chart on that. I forget where it is, but it's got to be coming up because it's in here. So let's make sure we understand we're not talking about, we can talk about depression, but when we talk about anxiety and stress, we're not really talking specifically about depression. And if true depression, probably we need to go to a physician and find out, what do I do about it? Or maybe you don't do a whole lot. Maybe you can do something simple and you'll be okay. But some people have really serious depression and they need a psychiatrist possibly, medication, whatever it might be. So depression gets into puts you in a really difficult position. And it's dangerous for some people. So it's something to be aware of. If you have depression, you need to get control of it. Anxiety disorders. There's all kinds of anxiety disorders, but the one that you hear people talk about a lot, and maybe for our purposes, panic attack. And we say, well, I got real nervous and I had a panic attack. But there's way more going on than that. Physiologically, what brings on that panic attack? Usually, in my experience, when you're starting to go under too much stress, you start to hold your breath. And when you hold your breath, your blood oxygen levels change. And that can be the thing that sets it off. Because I've seen people use oxygen and reverse the panic attack. Or you see people blowing in the bag. You can change your blood gases. But not everybody's aware of that. You're having a panic attack. What do I do now? I'm scared. My heart's pounding, and that's one of the symptoms. Your heart rate goes up very fast, very high. I've heard some big numbers, and I'm thinking, that's scary. And I can understand why you'd be uncomfortable. My very first job out of school, there was no job, but I was interviewing. And before the interview was over, I had I had the job because the person had a panic attack just then and ran out the door. It was the weirdest thing. And the boss looked at me and said, "When can you start?" And that person never came back. Apparently, I found out later that that person had multiple panic attacks over about a month period, and it just ganged up and it was too much. And that was the last time. And I took the job. And then I started thinking, well, if the job did that, what's going to happen to me? But for some reason, some people are okay in situations that some people aren't. For me, it was fine. But I can see why that could be a problem. So panic attack, we want to try to, actually we'll teach you, we can show you what to do for a panic attack. But I will tell you that breathing is the key. If you learn how to breathe correctly, if you feel it coming on and you change your breathing, you'll do fine. So natural interventions, that's what we're speaking about today. And we have some here. If you want to do something simple, just to see if you can curb your anxiety or your stress, we have a couple things that are really easy to use and really good things. L-theanine, an amino acid. L-theanine is very relaxing, very calming. We have a chewable, you could do one a day. Now, it won't work for everyone, but for mild stress, you can do quite well with it. And I'll give you an example. Actually, it's a 200 milligram dose, but it's so safe that I give it to school children, little ones, who get nervous going to school. What do you hear? I got a bellyache. Well, that's a symptom of stress. I've got a headache today. I don't want to go to school. So I've used not a children's dose, it's an adult dose, but amino acids are very safe. So it's not like you're taking a medication. And as long as their body weight, as long as they aren't really tiny, they're going to handle it. You don't want to give maybe a 4 or a 5-year-old, but if someone's in 2nd, 3rd, 4th grade and they're normal size, they're going to handle it quite well. And it may last all day for them, and they might even feel good at dinner time. Yes?
So do you take it in the morning? I wouldn't took it now for today.
Well, that's for other things, but maybe for somebody who goes to work and has stress, that type of thing, you might take it first thing in the morning before you go to work, or maybe when you get to work, or maybe when they don't want kids taking things to school, so they take it with breakfast.
So can you take it twice a day?
I wouldn't take the chewable twice a day. We have capsules, 200 milligram capsules, that would be economically less expensive. This is inexpensive at one a day, but you double up on it and it becomes more expensive.
Okay, which one are you using?
That's L-theanine. It's a chewable we have. And we have, if you needed to take 2 a day, like 400 milligrams, one for breakfast and maybe mid-afternoon or bedtime, you probably could use, the capsules would be more inexpensive. Yes. And of course, GABA. Now, we have neurotransmitters that kind of control things for us. And they do a nice job. They balance things out. Dopamine, GABA, acetylcholine neurotransmitter, serotonin, you know that one. We don't do much with serotonin. I'll show you what we do have for serotonin. But just because somebody has anxiety and stress doesn't mean they have a low serotonin neurotransmitter level. But it's been a practice, at least in medicine and pharmacology, to give a serotonin type drug. And sometimes, often, that works. But it may not really be as direct as giving the GABA for something like that, or L-theanine. And then, this will work most of the time, by the way, for most people with mild issues. Another one to look at, another way to look at it, is the acetylcholine neurotransmitter. And we have 2 things that can help. Now the acetylcholine, if we go back to the GABA neurotransmitter, that's focus and concentration and memory. But maybe that's not your issue when you're having anxiety. And if you do give focus to someone with anxiety, you get control, or they get control. So they feel a little better. But it may also be something in the acetylcholine neurotransmitter. And for that we have phosphatidylcholine, and that can be very effective also. You just have to try and see what works for you. We were doing some specialized testing. We don't do it anymore. LabCorp took it over. And you can only get it from LabCorp, where they actually test these things. And one thing that came up in the more senior population that's having trouble with focus and maybe stress, a little bit of anxiety, is serine. Now, serine is an amino acid. This is phosphatidylserine, so it's very specific, and it builds up serine in the system. And one thing we did notice very quickly with elderly, over 60, I don't know what you want to call that, is low serine levels. Serine levels seem to go down for some people. And I discovered, just looking one patient after another, if they're having memory problems, very often the serine was low. So it was only logical to add phosphatidylserine. And sometimes we got pretty amazing results and sometimes not so amazing. But it was worth a try. And a lot of people are doing better by adding the serine, which is an amino acid. You get it from foods, but it may not be that easy to get from foods. So why do they have a low serine level? I don't know. Could be digestion. They're not absorbing things properly. Maybe their diet isn't as effective as it could be. So we add the serine, and it does a very nice job. And phosphatidylserine, in particular, and this is just my way of looking at it, seems to work a little better in females than it does males. Also, it seems in the long run to have some kind of like a hormonal balancing type of effect. And that's what I think seems to help people. But it's been pretty effective and pretty successful for us. So that's why I included them in today's talk. Taurine, which I don't have up here, is a precursor to GABA. So sometimes if you're not getting the results you want with GABA, let's say you're having memory and focusing problems, you just can't work. You know, you pick something up and you want to study it, you don't get through the first 2 sentences and you're already here and there, all right? If you add taurine, let's say every night at bedtime, or morning, breakfast, doesn't matter when you add it. If you're using it for better sleep, bedtime might be a good time. But the taurine is a precursor, and it gets your GABA, your natural GABA going. So when you add a little GABA during the day in the way of a capsule, you get a better effect. So it's been very effective and very helpful. I also ran the Abington ADD Treatment Center, and we used GABA exclusively, and it worked really well. So kids with ADD, ADHD, it seemed to calm them and focus them. And that's probably all you need for most ADD children. Calm and focus. If you can do that, you might get a better result. You've got a student that's making progress. All right, so we covered those, and I didn't talk about SAMe. If you're not, and I did that on purpose, I should have written this the other way. So SAMe, which is really an abbreviation for this big long word, and you don't need to know it, is a great product for really when you're not being successful with other things. Now, SAMe is also sold for inflammation and pain because it is another amino acid, and it does a lot of things in the body. So if you have a lot of joint pain, muscle pain, SAMe can help. But for this particular talk, SAMe is, well, maybe that anti-inflammatory part of SAMe may have something to do with the brain calming, but it is very effective. And I've had some, over the years, when it first came out, I didn't know what to think of it. Not a lot of literature, not a lot of studies. And I think I used it on a teenager who got thrown out of public school and then private school. And it was a matter of control. How do we make this student more, not such a problem overall? And right away, it was very effective. And I thought, well, maybe there's something to this. Now, over the years, we've learned there really is something to this. And it can work very well, but it's not a first-line type thing. If you're not being successful, and your anxiety's out of control, maybe there's a little depression involved, SAMe may be a good possibility for you. More expensive, it is a patent, and everybody gets their little cut. Obviously, when you have a patent, you charge a fee. So it does make it a little more expensive. Prices have been coming down. I think maybe we're the only business in the world where prices sometimes come down. Everything else seems to go up. So I think there's more competitors now. More people are buying the trademark and the patent, and they're cutting prices and doing a better job. So that's a great thing. Before I switch, let's see. Well, before I say that, let's say you're just suffering from very mild bouts of stress and anxiety. So you don't jump on the heavy-duty products. We have things like Stress Calm. These are little tablets you put under your tongue and melt, and they melt under your tongue. That could be a very easy way to deal with a stressful situation. I get a lot of this. I'm getting on a plane in 2 days, and I get all freaked out. And although L-theanine might be okay for that, maybe something like that would be great. And if you really get panic attack type of anxiety, this is another, and they tell you to swallow these, but I always tell my folks to put it under their tongue and let it melt. Just a tablet, and it doesn't matter how you take it, but if it melts under the tongue and it absorbs quickly, you might get a better result. And I think it's true because I've done it many times. So this might be a simple way to do it. These are blister packs, so you can pop out as many as you want. Usually you take it once and maybe a follow-up in an hour and you're okay. And that might be a logical way to go. You know what? I might as well just keep going here. Magnesium.
No time like the present, right?
Hear about magnesium all the time. So somebody took a magnesium, it's Enzymatica as a matter of fact. I don't know if they own, well, there's a registered trademark. They may own the trademark. So what they created was an acetylated taurine-based magnesium. Nobody's done that, and I don't think they're sharing the trademark. Or I don't believe this is a patent. I don't think it was patentable, but they have the trademark. Now, eventually they'll probably share it, but for now they don't. They probably have an exclusive on it. I believe they own it. If not, it's the trademark holder that's keeping them in business, so to speak. This works really well because it crosses the blood-brain barrier very effectively. Most magnesiums don't. So you've probably heard of Magtine, which is another amino acid-based magnesium. Now that's been out for a long time. That is a patent, by the way. The patent company is, well, the Magtine's the patent name. I think that's the company also. Yeah, the Magtine or Mucogenics, Mucoceutics. It's a patent, and has always been relatively expensive, but it does cross the blood-brain barrier very effectively. This can be used for calming, sleep, attention, focus, all those things. Same as you would use this one. This may, I don't know if it'll prove to have an advantage. You just have to try it and see. Everybody responds differently, so you just have to try. By the way, I mentioned serotonin, and there are 2 amino acids that are effective for actually making serotonin, and 5-HTP is one of them. 5-HT is a precursor for tryptophan, which you always hear about turkey having tryptophan. So tryptophan stimulates serotonin, and I don't know about if you've tried it, but I know if I try it, I go to sleep. So tryptophan to me is I only use it when I hear sleep issues. A lot of doctors I know and have known in the past in Bucks County and across the river in New Jersey, and I've seen they've come to me for other reasons, and I see they're on tryptophan even during the day, but in a reduced dose. So it's tricky because some people shouldn't drive if they're taking it. But there are people taking tryptophan during the day and taking a higher, a bigger nighttime dose. So it's done. I find you use 5-HTP, you don't get sleepy during the day, and it works pretty much the same. Not for everybody. We've got a couple, these two you might consider these. So these are chewable. This works quite well for children that are just kind of can't sit still at school, a little anxious. So it's a chewable. It's definitely a children's dose. This will not work for adults. It's only 40 milligrams of L-theanine and 10 milligrams of GABA and a tiny bit of magnesium. It's got a little chamomile, lemon balm, all those things that kind of will calm a child down gently. And this is the adult version, but the formula is close but not exactly the same. You wouldn't want to give this to a child necessarily that's under 10. It's really an adult product. And it's a chewable. So why chewable? Chewables work fast because they go pretty much directly into your bloodstream. So if you're having issues, why not a chewable? So that has been kind of a good seller. In fact, we have plenty of this. We're getting a little low on that. It's coming, but it's moved quite well. These are two new products that we have in gummies, which is okay as far as I'm concerned because you're absorbing in through the mucosa again. And this one is really a sleep product. So if you've got a lot of anxiety, if you can't sleep, this might be an ideal if you like gummies to do the job. And this, which is kind of its big brother, is a GABA, passion flower, vitamin D, and saffron combination. Saffron is starting to become something people are thinking about more and more. It seems to work for a lot of people. Stress, anxiety. I wasn't a believer for many years. It was very high price when it first came out. I'm starting to see more, it being more effective. So I'm starting to believe that maybe it is a great product. So we do sell it by itself. We sell it in combinations. And this particular company, this is Bach that does these, the flower Bach people. It's kind of a nice combination. And chamomile and passion flower are in a lot of these products. And growing up, every time I was sick or things weren't going, anything, somehow it was cured with my grandmother making chamomile tea. All right, I'm sure a lot of you have experienced that. And chamomile tea is actually pretty effective in a lot of cases. So it's a good thought. Chamomile's been around for a long time. I don't know anybody who gets hurt by chamomile. Yeah. All right. Now, this is an interesting chart, although hard to read, which reminds me, we have a sign up. You can have my PowerPoint sent to you by email. All you got to do is sign our sheet, and I think it's over there somewhere. Patricia and somebody else has that sheet, maybe? Okay, so you can sign up for the PowerPoint with this chart on it, but I love this chart because it tells you almost everything. They thought of everything that can go wrong with stress and anxiety. And a whole lot of things can go wrong for you. So I put them in this chart, but the next chart is the one, I'm not there yet. We'll get to that one. Free-floating anxiety. This is the kind of anxiety that people take home from work. Maybe they've had could be a death in the family, it could be a whole lot of things. And somehow the anxiety kind of stays with you, and you go through it over and over again. And you never quite, like when I mentioned to you about stepping off the curb, everything kind of increases. Heart rate, all kinds of functions increase. You get to the other side and they go back down. So this free-floating anxiety is like they never went back down when you got to the curb on the other side. You're living with this, and it's running in the background like an annoying background program on your computer, and it's constantly just tearing you apart. And you go to bed at night, if you're lucky enough that you can sleep, that might help, but some people can't sleep. before you know it, you're doing 24 hours of this free-floating anxiety, and that is really bad for you. This chart kind of tells you everything about what's going to go wrong if you continue to keep having anxiety and stress. And right away, it's a problematic thing. You increase cholesterol. That's one of the effects that stress does to your body. And it's a life-saving type thing if it's in a short term. But in the long term, it starts to break, what is cholesterol doing in the inside of your arteries? It's damaging it. If it's only a temporary situation, we were cavemen, we're being chased by a dinosaur, well, maybe your cholesterol elevates for a number of reasons, but it's a protective thing. Would you believe I'm the only person here that forgot to shut off their phone? So, fatty acids in the blood for energy. Well, we don't want fat in our blood because that makes our triglycerides go up, and that's dangerous for us. So, that free-floating anxiety may do that. Decreased protein synthesis slows down intestinal movement. All these things are not good, but they're part of a temporary dangerous situation. The immune system and allergic response gets worse. So right away, there's a lot of things that start to go wrong. If we go out a little further, of course, blood pressure increases. All right, when we're put up against the wall and somebody says, "Give me your money," your blood pressure goes up. And increased metabolism, faster heartbeat, and faster respiration. For those of you that stay to see my little demo, you'll actually see breathing, you'll see heart rate. It'll all show on the real-time display, and that you'll see that specifically. Localized inflammation. So, like I said earlier, if you've got a backache, you can count on stress making it worse. Now, what if you're under stress all day? Well, you're going to have a big, longer, more painful backache. It's just the way it is. Just healing a cut might be a problem if you have too much stress. It just could change things enough that you're not healing properly. Oh, and a very good, almost forgot to bring this in. Back when I was doing hospital work, one thing that came to mind very quickly, if you have someone in a coma in the ICU, they're totally out for days. What do doctors worry about a lot? And what do they put in the pharmacy? What do they put in the IV line? Stress ulceration. Imagine you're out cold for a month, but they're giving you medication to prevent an ulcer. That's stress ulceration. When you're in a coma, you're having a very stressful situation. And just to show you how stressful, most people in a coma, if I remember my studies, are burning 4 or 5 and even 6,000 calories a day, not moving. So it's all that stress and all the things that are going wrong in the system. And when a person's in that condition in the ICU, you've got to be really careful. You've got to really take care of them. That's why those doctors are experts, and they're keeping you alive. And the pharmacy is giving you things, they're giving you 5,000 calories a day to stay alive. So this is the real deal. This is what's going on. This is what's harming you when you have anxiety and when you have stress. So that's why it's important to get control. Faster blood clotting. How if it's too fast, you're going to get blood clots possibly. You may throw a stroke. I mean, anything could happen. This is things you don't mess with if you can help it. Increased production of blood sugar for energy. Maybe that shows us triglycerides going up. None of it's good. Increased stomach acids. Well, there's where your ulceration might come in. So that's a problem. So what's a good way, if you've got nothing else, what would be a good way to lower stress? And it's very simple. This little walking chart tells you everything. Get out. You know, walking on a treadmill, if it's a rainy day. But you need to be outside in light, as much light as possible. Sorry for the dermatologists, but get out there and get light. And walk. Walking is a rhythmic type of movement. When you're walking maybe to music, or people just tend to walk rhythmically. If you watch them, somebody's got a hip problem, a back problem, they may not walk rhythmically. They may kind of have problems. With the average person, if they don't have a limitation, they walk rhythmically. And I've watched very carefully a lot of people. You take, let's say you lead with the right foot, you tend to inhale or exhale, you walk, you step, and you take the next breath. So if you're walking rhythmically, you're breathing rhythmically. And when you breathe rhythmically, you balance your blood gases, oxygen and CO2, and you feel more calm. So as you watch this, or as it says there, 3 minutes, and your blood pressure decreases. Your heart rate also decreases. In 5 minutes, mood improves. 5 to 10 minutes, creative thinking. I don't know if I get much creative thinking, but I'm walking anyway. And 40 minutes reduces the risk of developing, you know, if you walk 40 minutes every day, you're doing a great job. And you are fixing your cardiovascular and a whole lot of things, and you're reducing your stress. 90 minutes a day, which a lot of us can't do. I have trouble doing it. You know, for 90 minutes, I have a hard time taking that chunk out of the day. However, I still walk almost 10,000 steps a day, which would be equivalent or maybe more. So I'm getting something in, and I may not get it all at once, but if you can do 90-minute walks, it'll reduce even depressive thoughts. Yes?
Do we need to do this walking continuously one time to get the effects, or is it okay to walk like maybe?
Yeah, you can break it up. Sure. As a matter of fact, taking a walk after each meal is quite an ideal thing, because it's going to help with digestion. It's going to, if you've got reflux, it might improve that. And there's a lot of things about walking after a meal that's very helpful and very healthy. And if you spend any time in Europe, and I haven't spent any time anywhere else in the world except the United States and Europe, Europeans, many European countries, especially the warmer ones, better climates, they walk a lot. They eat dinner, clean up, and they hit the street. They don't want to be in their apartment, their house, that type of thing. They get out. And they walk. And they might walk 2 hours. I mean, I watch them, you know, I'm sitting in downtown Athens or something, and they were just walking around everywhere. And I'm thinking, this is not like America. This is totally different. You'll see that in Rome. You'll see that in Spain. It doesn't matter where you go. Maybe, I don't know the Nordic countries, and I don't know what they do because they've got all that bad weather. But walking is a pretty neat thing. Generalized anxiety disorder, that's where you end up when you've had too much stress and too much worry and too many problems. I don't think we have to get into that too much. But it is definitely something that's going to pull the rug out of your health and out of your system. Panic disorder, we talked about that already, but if you want to stop a panic attack, say you feel it coming on, right away take 3 big deep breaths. Once you change your blood oxygen, it's not going to be a problem usually. If you don't do anything about a panic attack, you let them happen again and again and again, you risk the possibility of habituating the panic attack. So you're going to be getting them all the time, and you're going to be just like a victim. You won't know when they come on, what sets you off. Something nice could set you off. And I'm trying to think, I think there was someone that told me when they watch a movie, for some reason when they get into the movie, they notice they were holding their breath through the movie. So maybe 45 minutes, 35 minutes into the movie, they'd have a panic attack. So now they don't want to watch movies anymore because they think movies are giving them the panic attack. What it is, they get excited or they get into the movie, and they were just holding their breath. And they cause their own panic attack. So breathing's important. In fact, I tell my patients that I work on that are having problems, I tell them, some of them have timers, that type of thing. Every 15 minutes, take 3 deep breaths. You're at work, set your timer so you can take 3 deep breaths every 15 minutes. So you break the cycle, you correct your blood gases a little bit, you slow down your heart rate, maybe you drop your blood pressure a little bit. So that's a really important thing. In the meantime, I've also got them doing other exercises, maybe not at work, but I'm teaching them other techniques. But I want to keep them in a position where they don't have a panic attack because it's going to wreck my treatment. And they'll feel better if they don't have the panic attack. So take 3 deep breaths every 15 minutes. Nobody's going to know you're doing it. And you'll feel better. That makes sense? And none of us are doing that. I'm not even doing it. But every once in a while I'll sit down and I'll say, oh yeah, time for a nice big deep breath, and I'll get it in. So it's important to start including that, because the more you don't do it, the worse your breathing's going to get. And if you stay for the demo, you'll see breathing and what breathing should look like and what most people breathe, how they breathe. What you would see, breathing should be a pretty smooth wave if we're looking on here, if we're looking in a software type of thing. And what you'd see for a lot of people is this. It's like, a sawtooth thing. So to be relaxed, 6 breaths per minute or less is relaxed breathing. If you're sitting in a chair, you're not doing much, then you shouldn't be. Why are you breathing 12 breaths per minute? I see that all the time. I've seen people 18 breaths per minute. You wouldn't know it because it's so shallow and fast, you almost can't pick up on it. I can, but most people wouldn't. Why are you breathing that way? I can't breathe 18 breaths per minute. Running, I can't do that. How are they doing that? And it's forcing their heart rate up, and it's probably forcing their blood pressure up. You should be breathing 6 breaths per minute when you're sitting in the chair relaxing. If you're not there, something's wrong. Panic attack, we talked about it. Panic disorder, same thing. Obsessive compulsive, that's all part of the issue. And you can control some obsessive compulsive behavior if you do the breathing correctly. And basically, if we can teach you the breathing techniques, and we can do this, I even have a couple, 1 software, 2 software programs that I will put on your iPhone, or you put it on your iPhone, they're free, and it will actually help you train your breathing. If you don't have a phone, which some of my clients don't, I have them get a clock with a second hand on it. What happens when you inhale at 12 and exhale at 1, inhale from 1 to 2, exhale from 2 to 3, the whole way around. Guess what? 6 breaths per minute. All right, 6 inhales, 6 exhales. So you can train using a clock. Doesn't cost you a thing. And it's perfect. And then if you did it for 2 minutes a day for about 6 weeks, you would breathe that way all the time. It would just naturally come to you. And I can sit down and hook myself up to a program, and I can do 6 breaths per minute without even, I know what it feels like. In fact, for me, it's actually, because I do it so much with clients, kind of drop to 5 breaths a minute when I'm almost not thinking about it. So it could help. And OCD is it's a difficult condition. So whatever you can do to help that isn't medication, medication's always there. But if you can do your own work, help the doctor out a little bit, why not? Phobias. It's part of this whole thing. And phobias can really be strange. You know, everybody gets little phobias. I'm sure I have a phobia. Oh yeah, cardboard. I don't like my nails to touch cardboard. Is that a phobia? I'm not sure, but it's weird. Social phobias. Oh, one thing I do for people, and I've done for many years, even before I started doing this type of thing, was training people to speak in front of crowds. Not just people who have the phobia like, I can't speak. I was training people on an executive level to speak, to groups. And it's funny how they can improve really quick when you give them the techniques. But for someone who really cannot be in front of a crowd, it's pretty scary. But you can train that into somebody, and they can be more effective in their speaking. I think when I worked for 3 different pharmaceutical companies, inevitably you're going to have to talk to a group of 10 or 12 people once a month at least. You've got to present something. Well, you could see certain people did quite well, and some people were not ready for it. Some of them didn't even know they weren't ready for it. They got up there and like freeze. In fact, had a radio show here for 5 years, and I was pretty naive when I started the show. I was a guest on shows. I never hosted the show. So I just start the show, and then the first show I had a wonderful guest, and it went wonderfully. So I thought, oh, this is easy. I could do this all the time, and I did. So the third show, I had someone come on, and it was a professional, and I forget who it was. I asked the first question, total freeze, dead air on radio. And I'm thinking, oh my God, he can't talk. What am I going to do? So I quickly told the engineer to go to the first commercial, and I had to, for 2 minutes, had to talk this person into answering my questions. All right, it was really scary. That was a total freeze up. And after that, I would say we had a good 45 minutes of talk. Kind of got his breath. He wasn't breathing. You could see it. His face was like a beet red, I could describe it. It was scary. A couple weeks later, I had the psychiatrist from our practice come on. He's going to do a great job, right? Same thing. And went to commercial. And I said, you've got to get a hold of yourself and just, it's just like when we do talks. He spoke every month to the residents. I think it was just the situation of being with a microphone in your face and all that. And he calmed down, he had a drink, and we had a great 45 minutes again. So, put somebody on the spot and this can happen. So that can be phobic in many ways. And I still train people for public speaking and that type of thing. Post-traumatic stress disorder. Anything can cause this problem. I was in a car accident, 1964. I was a passenger in the rear seat. We came to a stop, it was on the turnpike, so it's high speed. Came to one of these stops, like that. No seat belts in the car back then. And it dawned on me as we're crashing, we didn't hit the car in front of us. We missed by about a foot. Better turn around and look and see what's coming. And as soon as I turned my head, creamed us, and then just wrecked the car, and my head hit the ceiling. I've never to this day been a passenger in the car when they hit the brakes really hard that my head doesn't go like that. I cannot stop that. that's what that is. Of course, mine's minor. People have horrible problems with this. And, could be anything. Could be, I actually was in an explosion one time. Luckily, I don't have a problem with that. But you can imagine someone's been in the service that hears explosions all the time. Right? It's not a pleasant thing. There are sex differences, male, female. Females have more issues with anxiety. Go to a psych office anywhere, there'll be more ladies in there than men. Either the men are hiding it, or maybe not. I don't know. But yes, there are differences. There is an age. One thing I've noticed in females at that age group, maybe particularly 14, 15, I do see a lot of anxiety. I don't know if it's school. I don't know if it's peer pressure. I'm not sure what it is. It could be all those things. So that's something to think about. Lack of social connection, that's going to make it worse. And people with anxiety disorders are at an increase of several medical conditions, including, like we've talked about, blood pressure, cardiac issues, arrhythmias. Arrhythmias are really tricky. That's something a cardiologist should play with only. And who knows? I can see arrhythmias in my software. I had a lady who had an arrhythmia every 20 seconds. I couldn't treat her because she messed up my software. It was too much artifact overwhelming my data. And I said to her, "Do you feel that every time?" She goes, "Oh yeah." She said, "I've had it for 30 years." I'm like, wow, that's got to be unpleasant. Yes. Well, that could be heart attack. It could be anything that could be part of that. So you don't want this, obviously. So having an increased heart rate all the time is going to catch up with you. Signs and symptoms of anxiety disorders. I think we've kind of hit them all, but this is just a brief. Difficulty concentrating, irritability, tense muscles, that's a big one. Sleep disturbance, that's a huge one. Difficulty, by the way, in sleep. I have a product like this, which is stress and anxiety, and we have some sleep-specific ones that very often use the exact same ingredients to help sleep. And melatonin, which you probably all know about, is actually a serotonin stimulator. So in many ways, melatonin is actually healthy when you take it, but you should never take it in high doses. I've always been successful with low doses. Some of the companies have really pushed the dose. I don't really think that's necessary or necessarily good. Yes?
What about natural lavender? Because I've been told by how low of a dosage lavender is also helpful with stress.
It could be, but it seems to me it's more of a entry-level kind of product for someone with mild sleep issues. I don't think it's going to help somebody who has a real difficult time with sleep. Yeah?
How low of a dosage would you recommend?
Oh, I'd start at 1 milligram. Yeah. See if that works. If it doesn't, you try 2 milligrams. No reason to rush. You've had the sleep problem for a while. Why rush in and put too much in?
During sleep, I just mean it for stress, lasting for stress.
Yeah.
I got it at the blister packs.
Mm-hmm.
That actual,
Yeah, it's a possibility. People have topical lavender that they use. I mean, there's many ways lavender can be used. But again, it's more of an entry-level type thing for mild issues. Oh, I went back. Overcoming worries, that's always an issue. But let's, that's additional things that we already talked about. So let's go right to here, which is the end, and stress reduction. These are the things that I usually recommend. I don't necessarily do them all, but I recommend them. Biofeedback, hypnotherapy. A lot of people find hypnosis I don't want to be hypnotized, so I don't do it. But I have used hypnosis. And in fact, I just recently, I don't know why, but I just recently got certified twice. 2 different types of hypnosis. So I thought, you know what, it's time to re-up, and see if there's anything new that I can learn. So took a few courses, and I spent a lot of time and money trying to get myself something new in hypnosis. And there isn't a lot new, actually. Yeah, techniques, people have different techniques, but it's really can be a wonderful thing for some people. But like I said, a lot of people are a little standoffish when it comes to hypnosis. I enjoy doing it. Yes?
Could you get a person who's in an anxiety attack, could you get them to calm down enough to work?
Yes. Yeah, simple answer, yes, but it's more complicated. Yeah. You teach them self-hypnosis techniques so that they can do it as they need it, not necessarily in the office. Exercise, well, that's an easy one to do, isn't it? We talked about walking. Sunlight, very important. I would say our patients, I had to go to homes sometimes. And when I worked for Bucks County, I worked for Bucks County Mental Health. And I found myself in the homes of people who had mental health problems. And if you want to see heavy-duty curtains, that's the person that has them. Dark, the windows are never open, and I go home and I'm there, oh my gosh, I love these windows suddenly, You don't want to be, you want to see sunlight. It's going to change everything. It's going to make things better. Fresh air, very important. If you've got sleep problems, you're not walking enough. You're not out in the fresh air enough. I moved, I think one day I moved 60 wheelbarrows of mulch. All right. And that night, I wish there was a way to record there was a way to record my sleep. I actually have a wrist thing that actually records my deep sleep and shallow sleep or lighter sleep. But there was a lot of dark lines of deep sleep that night, and I slept like 9 hours. I was exhausted. But that's what you got to do. We're built to work. We're not built to just sit in a chair and watch TV all day. And don't expect yourself to sleep if you don't get out and do something and get fresh air and get light. And you should sleep in darkness, and you should be awake with a lot of light. It's just how we're built. If you don't do that, things aren't going to go well. Music, pretty obvious. Music is rhythmic, and our bodies adapt to rhythm. When I was, I think in 5th grade, I discovered that we were doing some kind of thing with your heartbeat in school. We were supposed to record it, something very simple. And I noticed that the radio was on, and my heart was beating to the rhythm of each song. It was correcting to each song, or adjusting to each song. Well, that's because of the brain and heart connection. And music does that for you, and that's a good thing. Makes you feel better. I like watching Seinfeld. You laugh. Laughing's a good thing. A good night's sleep. If you're not getting good night's sleep, you're not doing very well. It's very, very important. All right, questions?